Okay, right. Okay, I'll start again. Thank you very much. As Professor Tamerlan observed at the beginning, our work in IAP and the regions is separate from the EMME initiative, but of course there are many mutual interests, and I hope that that there's added value in us sharing what we've been doing. Andy Haynes has already given a very comprehensive overview of the climate change challenges to health in this region and globally, and indeed how we might respond in terms of adaptation and mitigation. Okay, so I'm Robin Fierce, and I'm drawing on work from EASAC and IAP. Can you go on to the next slide? Okay. Right, so this slide actually is drawn from the work of the US CDC. It summarizes it in a slightly different way, many of the things that Andy has been talking about in terms of the direct and indirect effects on health. I'll mention a couple of these, and Andy has mentioned more. I just want to emphasize that clearly there's a very wide scope of effects that we need to be covering throughout our workshop. Next slide. As Volker introduced, we have an IAP project on climate change and health running at the moment. 4 regions from Europe, Africa, Asia, and the Americas. In one sense, the region of the Mediterranean and Middle East falls in between our IAP regions for Europe, Asia, and Africa. And this workshop, therefore, is very important to add inputs to what we've been doing in our regional working groups. And of course, greatly welcome your perspectives on what I'll be showing you in the next few slides. Okay, next slide, please. Right, so how can we add value to what's already being done on these topics? And he mentioned a couple of fairly large consortia activities that are already active. For example, the Lancet Countdown. We know the IPCC will be delivering its 6th assessment report next year. WHO is active in regional consultation. In our experience, IAP adds value to what can be done by others in several ways. Inclusive across the scientific disciplines, for health sciences, but also natural and social sciences. Integrating evidence and perspectives from the national, the regional, and the global activities, with particular focus on what science and innovation can achieve. In taking the regional-based approach, we capitalise both on the expertise within the regions, but of course need a starting point to drive our agenda. We aim for a consensus in our outputs, yet using our expertise enables us to tackle controversies that may be difficult to tackle in some of the other intergovernmental work, for example. The work is based on delivering common messages, but we recognise the underlying diversity, and indeed in talking about opportunities and challenges, as Andy has done, we emphasise the need for the evidence base and to fill gaps where they currently exist. Then we're inclusive, we involve younger researchers and all of the countries in the regions, and we have a capacity to follow up what we're doing at the local, regional and global levels. So next slide, please. Okay, so inevitably in an interregional project design of this sort, we need to have a common starting point to drive our activities. These questions were agreed by our regional working groups, and they may seem fairly obvious, but I think they do cover a lot of the points that Andy has been talking about, and indeed the ones that we need to clarify in our work around the world. So what are the main effects now? What can be anticipated in the future, subject to Paris Agreement and so on? what might be some of the solutions for adaptation and mitigation and resilient systems? What do we need to do to improve the evidence base? How much more do we need to do to focus on vulnerable groups in different regions or different population groups? How can we link this work? And indeed, how can we link this work with other important global and regional initiatives, for example, those involving the Sustainable Development Goals? So these were our starting points for our work. And in the next slide, please. Next slide. The report on the European part of this project has already been published. It was, as was mentioned previously, it was co-chaired by Andy and Volker. You see here the composition of our working group. Other countries in the region were involved in peer review and endorsement, but these were the countries actively participating in the working group, and we had very strong representation from Cyprus and Greece, but not actually very many others in the Mediterranean area. And that's one of the reasons why this current workshop is of great value to us, to augment the coverage that we addressed in this report, and indeed to bring issues for the wider neighbourhood, the extended region, to the attention of EU policymakers. Next slide, please. Okay, as Andy mentioned, covered it in very valuable detail, climate change is already bringing many major challenges to health. But there are solutions possible by acting on our present knowledge and by filling the knowledge gaps with new research. So essentially, the main messages relate to this. You know, there are threats. We can capitalize on science and technology, but we do need to work quickly, and we need to do much more. Of course, the detail on the different pathways for doing this is discussed at some level in the EASAC report, and I only have time for a couple of examples in my next slides, and they address issues that Andy has already introduced. So the next slide, please. All right, thinking about food systems and agriculture in the European area, and we've already heard climate change maybe is adversely affecting agriculture, both in terms of cereal crop yields and nutritional quality around the world. In Europe, in the wider European region, the effects are mixed. In some countries to the north of the region, that there may be currently an increase in crop yields because of a more favourable climate in Northern Europe. However, these benefits may well be overtaken in due course by accompanying changes, for example, in the extended distribution of pests and diseases for crops. It's not just a question of temperature and precipitation. Climate has a number of other effects that are influencing agriculture. And indeed, elsewhere in the region, particularly, of course, in the Mediterranean countries, we're already seeing adverse effects on crop yield and crop quality and vegetable and fruit quality. These problems are likely to continue unless we act. And clearly, as Professor Papanikolaou mentioned, the Mediterranean is a hotspot for European considerations. Okay, next slide, please. And you also mentioned problems of infectious disease, vectors and pathogens. Some of these problems are shared in Europe, and the work of the ECDC and Professor Semenza that Andy mentioned previously has been core to our understanding increasing threats from a range of infectious diseases, vector-borne, waterborne, foodborne, in a number of cases related to extended distribution of the vector. are complex interrelationships. And I'll just give one example in my next slide. Next slide, please. Okay, and this is the work of the ECDC in Stockholm on West Nile virus. These were the most recent data published at the end of last year, and in fact update the discussion we have in our EASAC report. And broadly over the past few years, there's been both a westward and a northward extension of West Nile virus in Europe, and projected to continue. And I think I use this slide to illustrate really one point, that even for those of us in the EU, we need to be very conscious of what's happening with our neighbours in the larger region, including, of course, the Eastern Mediterranean, Middle East area. It's often been said that infectious disease knows no borders, and we can see this clearly in the increasing effect of climate change in Europe. Next slide, please. One other point to support the conclusion that we must be aware and considering great detail the neighbourhood issues comes from the Arctic. EASAC recently worked together with IAP and the US Academies in a workshop which was published here, and I refer to it for detail. But essentially, as has been said previously this morning, the Arctic, like the Mediterranean, is warming faster than other regions. One of the consequences of Arctic warming is the thawing of the permafrost ice layer. Andy mentioned that in terms of consequences for potential sea level rise and tipping points for flooding. But there's another potential consequence that's been studied, and that's the release of pathogens from the thawing permafrost. These may be entirely novel pathogens, or they may be potentially re-emerging diseases such as anthrax. And there's been examples, for example, in the Russian Arctic, where episodes of anthrax have emerged from the thawing of animal carcasses that were diseased in the last couple of centuries. So neighbourhood issues are important for all of us. And of course, microbial threats are core to the consideration of some of those problems. In the next slide, my final point about infectious diseases is to come back to the issue of COVID-19. COVID and climate change can be perceived as converging crises, both having significant impacts, of course, on public health systems and the economy, both having disproportionate effects on vulnerable groups, and indeed interacting in various ways. For example, around the world, flooding has compromised the response to COVID-19. Effects of COVID-19 on food systems may compound the vulnerabilities that we talked about from climate change. So they are interacting, that they are converging health crises, and we need to take account, of course, of the response to the pandemic in the response to climate change. But there's an opportunity here, and opportunity comes from planning for a sustainable recovery after COVID-19 that many of our countries are currently thinking about. How do we restore our economies? It's important to do that while also pursuing the objectives for climate change and the environment. That is, we need to ensure that we have objectives for equity, for the environment, and for health, as we consider how to develop plans for economic recovery after the pandemic. Right, next slide, please. Okay, from our EASAC report, we made some general recommendations on strengthening and using the scientific evidence base to inform policy on climate change and health, and really identified four rather general priorities: the need to link research information with policy development, That's both for adaptation and mitigation, and for integrating those policy developments. So, for example, we minimise unintended consequences, and Andy mentioned one about potential inadvertent consequences of tackling air pollution if you also reduce the aerosol-induced cooling. So we need to take an integrated approach to using research. Secondly, we do need to do more to use health information in communication, communicating about the problems of climate change more broadly, that we heard that in the discussion, but also communicating about how citizens can make healthy, sustainable choices in their lives, but very much also countering misinformation, whether that's about whether climate change exists or whether the pandemic exists or whatever. There is a responsibility for the scientific community to tackle misinformation as well as promote understanding based on the evidence. Thirdly, we need, as it came up in a discussion previously, we need to use the evidence that's already available. We can act on the basis of the science and technology information that we have. We need to emphasize that health is relevant in all policies, and that enables, as we talked about previously, to raise the profile of how we can effectively act in adaptation and mitigation. And finally, of course, we need to make the case for generating new information to fill the knowledge gaps. Had some examples of that with regard to knowledge gaps in quantifying the solutions, in understanding the position of vulnerable groups, in developing concerted action worldwide. I hope we can return to some of the discussion of what we need in new evidence later on today. Next slide, please. So how then do we get policymakers to listen to us? Question that was asked a few minutes ago. And how are these 4 general priorities for using evidence, how can they be translated into action? Well, here are some of the policy actions that we're relatively familiar with at the European Union level, and I think they're relevant for a number of other regions and countries. That the scientific community can help, and indeed is helping, to inform national climate adaptation strategies and plans for health adaptation, essentially to raise the profile of climate change in national health priorities. Secondly, to emphasize the role of health in mitigation strategies, and particularly in the NDCs that all countries must do and must update at the moment. Health is important with regard to choosing mitigation strategies for co-benefits, as Andy introduced. Thirdly, at least in Europe, we have a number of other current policy initiatives relating to sustainable food systems, preservation of biodiversity, development of the circular economy and of the bioeconomy, and of course the Sustainable Development Goals. There are opportunities in all of these policy areas to emphasize the issues for climate and health. Fourthly, as we mentioned, of course, we must also be very aware of the opportunities to advise on investment priorities for new research and monitoring. The next bullet, and this is for the EU, of course, the understanding of the impacts in the EU and the impacts of action in the EU are not confined to EU member states. We must be conscious of neighbourhood actions and influences. And I'll give an example from the Arctic, but the Eastern Mediterranean and Middle East is a very, very important neighbouring area for the EU. And finally, as I mentioned, we can capitalise on the current political interest in public health during COVID to re-emphasise the value of bringing health issues into the discussion for the economic recovery and more broadly for political decisions. So here are some of the opportunities at the EU level that EASAC has been working on. And in the next slide, I show, next slide. So this is what we've been doing during our working group activities and since publication of the report in 2019. We've done a number of things with a number of different groups, policymaking groups. So, for example, at the EU institutional level, EASAC has engaged with a number of the different Directorate Generals and the Commission's own scientific advisory mechanism. We've engaged with members of the European Parliament through various committees, particularly the Environment and Public Health Committee late last year. We have presented during successive presidencies of the EU, particularly, for example, the presidency in Finland a couple of years ago. In addition to the EU institutions, of course, there are a lot of relevant intergovernmental regional offices, and I commend these interactions also for interaction in the Mediterranean region. So the WHO regional office, the FAO regional office, and the Economic Commission regional activity. EASAC has been involved with each of these and continues to do so. And then finally, of course, what we've been doing at a regional level is also very, very relevant to action at the national level. And it's a great strength of the IAP and EASAC projects that we can engage with our member academies and continue to engage with our member academies in following up with our messages at the national level. So we get a catalysis and augmentation of the communication opportunities. And of course, we also engage more widely with the scientific and health communities in various scientific events. Next slide, please. Next. Okay, so just coming back to the IAP global level, that the project is currently underway. As you heard, the other regions, Africa, Asia and Americas, will generate and publish their regional reports this year, and we will have a global report next year. But even before these reports are available, we are very active in engaging with various policymakers worldwide and at the regional level, building on our EASAC contacts and also other work of the IAP in engaging with policymakers in various UN organizations, WHO, FAO, Economic Commission, and so on. And also, particularly this year, COP26. We hope to be actively involved in COP26, and indeed, as Andy mentioned, next year, COP27 in Africa. But very recently, we've been very actively engaged in providing scientific advice to the UN Food Systems Summit, and that advice includes consideration of issues for climate change and food systems. Not just the UN, but as you know, a variety of other intergovernmental bodies, G7, G20, and the Intergovernmental Panel on Climate Change. And we try to interact with each of these to bring our information and our advice to the attention of policymakers. And then finally, there is ongoing activity to raise the visibility of our work and of the issues and of solutions more widely in the scientific and health communities through various global events. Okay, my last slide, please. I think my last slide is to thank you and conclude by repeating the point that the discussions today in the workshop are of course of very great value to the Cyprus government initiative for the Eastern Mediterranean and Middle East region. But in addition, in inviting other countries to this workshop through our IAP member academies, we've taken really an expanded view of the region to include more of Eastern Europe and North Africa. Including this geographical diversity is of great value to EASAC in helping us to engage with EU policymakers with regard to the neighbourhood policy that they're pursuing. But it's also of great value to IAP to augment the considerable work that the IAP regional working groups are already doing in covering Asia and North Africa. So thank you very much for listening, and thank you for your contributions later today. And I look forward to some great discussions again. Thank you.